Today's topic is silent killers of the heart. Know the signs. It is called as a silent killer because it often develops without obvious symptoms until a serious event like a heart attack occurs. One of the major and the biggest challenge is that many people doesn't have symptoms for years. Heart disease remains the number one cause of death globally. Countries like India continue to see increasing number of cases due to lifestyle changes, urbanization, diabetes mellitus, hypertension, and stress. When symptoms do appear, they may include chest pain or pressure pain radiating to the arm, jaw, neck, or back, shortness of breath, sweating, and there can be nausea. So, ignoring this sign and symptoms can lead to heart attack or even sudden cardiac death. Don't wait for a heart attack to start caring for your heart. Today's webinar is titled Silent Killers of the Heart, where we will discuss the major risk factors that often go unnoticed, such as high BP, diabetes mellitus, high cholesterol, smoking, obesity, physical inactivity, stress, and unhealthy dietary habit. We will also talk about the practical steps that each of us can take to protect our heart and improve our overall well-being. And my today's goal is not only to share medical information, but also to encourage everyone to adopt small, sustainable lifestyle changes that can make a very big difference in preventing heart diseases. I sincerely thank Vishwa Talks for this opportunity and thank all of you for taking your time to join this session. I hope you find it informative, engaging, and useful. The today's topic is silent killers of the heart. Know the signs. It is called as a silent killer because it often develops without obvious symptoms until a serious event like a heart attack occurs. By the end of this session, you will understand how heart disease develops, who is at a risk, how to recognize the warning signs, and most importantly, how to prevent it. Now, first slide is what is heart? Now, everybody knows that yes, there's a part in our body which is an integral organ which helps in promoting and doing all the activities. So I have to tell you, our heart is one of the hardest working muscles in our body. Now, if you're thinking that heart is only an organ, no. Heart has also got some muscles, which is the hardest one. I mean, they work continuously 24/7. It beats continuously throughout our life, pumping nearly 4 to 5 liters of blood every minute whenever we are resting. Now, if I'm talking, it doesn't mean that my heart is not pumping. It is pumping continuously so that our other organs of our body can receive blood. The blood which is the blood carries, I mean, the blood which is originating from the heart, it's carrying oxygen, nutrients to every organ. And interestingly, the heart also needs its own blood supply through the coronary arteries. And if this arteries becomes blocked, the heart itself begins to suffer. Now, if you can see, there's a very big word which is written in the slide. It is called as atherosclerosis, and which is causing a very major heart disease, which is called as coronary artery disease. Now, over time, fat, cholesterol, and other substances which we are taking in our day-to-day life accumulate inside the artery walls. Now, what is artery? If you remember the first slide, arteries, coronary arteries are the arteries, or I'll say that it is a pathway which carries blood to the heart. Now, imagine the artery. I mean, just think it is a pipe kind of thing. If there are things which are accumulated, now obviously it will be jammed, right? So similar things happens in the heart as well. So over time, the food items which we are taking, which contains fat, cholesterol, and other intoxic substances, gets accumulated inside the artery walls, forming plaques. And this process is called as atherosclerosis. Now, what will happen? As this plaque builds up, the arteries becomes narrowed out. I mean, if you understand, the artery size is this because of the deposition of the other intoxic materials, it becomes very narrow down. Now, if it is becoming narrow down, what is the result? It will reduce the blood flow to the heart, and when this affects to the coronary arteries, it will be called as coronary artery disease or CAD. Now, if blood flow becomes severely restricted or completely blocked, it can result in a heart attack. Now, we have a myth that fat deposits occur only at the old age. Many people believe that heart disease only starts in the old age, but that's actually a myth. Now, if you see, there are young people who are having cardiac arrest and they are dying. So, research has shown that fatty streaks or the intoxic substances in arteries can begin as early as childhood, even around 2 years of age. That's why nowadays the dietary habits of the baby is also being changed. If you compare to the older times. Now, this disease progresses slowly over decades before the signs and symptoms appear, and this is why healthy habits should start early in the life. Now, it's not only the heart which is getting affected with this intoxic substances. Atherosclerosis, which I have just explained, it doesn't only affect the heart, it can also reduce blood flow to the brain, leading to stroke, which is again a very common condition which is affecting most of the people. It can also affect the blood supplies in the legs, causing peripheral vascular diseases like varicose veins, DVT. So, heart disease is actually a disease of the entire blood system. If you're thinking that no, if I am eating something, it is only going to affect my heart, it is absolutely wrong and it is a myth. It's not only going to affect heart. Obviously, heart is a major organ, but the other organs are also affected and cause many life threatening conditions. So, whenever this fatty deposits and all these things are accumulated, the heart disease, the heart will look like this. If you can see the image, how bad the heart looks, and this suffocates the whole body and it will be called as a silent killer. Now, coming to the sign and symptoms, now how we will identify that yes, it is CAD, coronary artery disease. One of the major and the biggest challenge is that many people doesn't have symptoms for years. Yes, there are fat depositions which are happening inside the arteries, but the sign and symptoms might not arise in the early time. So, when symptoms do appear, they may include chest pain or pressure during the activity. Whenever you are doing any kind of physical activity, you will feel a slight pressure. It might not be a pain, but you will feel a pressure. Like whenever you're climbing stairs, whenever you're walking, you will find a slight discomfort. Now, second sign and symptom, which is most important, is pain radiating to the arm, jaw, neck, or back. Now, I guess everybody is very much aware that if the left side, left hand, arm, jaw, neck, or back, if it is paining, it might be a heart CAD. So please understand. Now, many of the time it is said that heart is in the left side, right, or right side. Many people say left side, right side, but actually the heart is in the center. Okay, so you might feel pain here, and many of the people understand that it's gastritis and they get confused between heart attack and gastritis. So please understand there might be a pain, chest pain, or pressure in the middle, and the pain can radiate towards the left side, mostly in the arms, jaw, neck, or back. Now, third sign and symptom will be there can be shortness of breath, you can feel breathlessness, there might be sweating, and there can be nausea. Now, what is nausea? You'll have a tendency to vomit, but vomit will not come back. A vomit will not happen. Okay, you will just have a tendency that, oh, I have to vomit. And that is why people get confused in gastritis, because in gastritis also people have the tendency that, oh, they'll have a feeling that they want to vomit, but vomiting is not happening, and which is called as nausea. So ignoring this sign and symptoms can lead to heart attack or even sudden cardiac death. Now, how big is this problem? Correct, heart disease remains the number one cause of death globally. Although developed countries have reduced death through awareness and prevention, countries like India continue to see increasing number of cases due to lifestyle changes, urbanization, diabetes mellitus, hypertension, and stress. Now, as deaths are happening, it's a burden for our country, isn't it? So, this slide highlights the enormous burden of cardiovascular diseases. Beyond affecting health, it impacts families emotionally, financially, and places a huge burden on healthcare system. This is why prevention is much more effective than the treatment. Now, if you can see my slide, it's not only cardiovascular health or heart attack which is affecting the people. There are many other conditions which are acting as a burden in our country. Now, if you can see stroke, if you can see lung cancer, if you can see breast cancer, if you can see other diseases, it's affecting India like anything. This is a picture which I have taken from a survey from 2021, and it is acting as a burden for our country and the healthcare system. Now, why? I should be worried. Why should Indians be worried, right? Because we are living in a country where food is very important. All the foods are made in ghee, all the foods are made in oil. So, yes, Indians should be worried because studies shows that Indians develop heart disease at a very young age compared to many other populations. Even with lower cholesterol levels, Indians have a higher risk because of genetics, diabetes mellitus, abdominal obesity, and lifestyle factors. And this makes early screening especially important. I mean, if you are having, I mean, we are going to discuss the risk factors in the furthermore slides. But yes, as Indians, we should be worried because the statistics are showing that at a very young age, people are getting cardiac arrest. Might be because of their diet, might be because of their lifestyle, urbanization. There are many factors which are causing this kind of conditions in people. Why I mean, am I at a high risk of getting a cardiac arrest or a cardiovascular disease? Yes, because there are some risk factors which are modifiable. I can modify it, which are non modifiable, correct? So heart disease doesn't happen because of one single reason. Some factors like genetics, I cannot modify my genetics, right? If I have a history that my father, my grandfather, my mother, my grandmother, or my paternal grandfather or grandmother had cardiac arrest, then yes, I am at a risk that I might also get heart conditions, right? So some factors like genetics, age, I cannot change. I mean, yes, because of this, I will be at a high risk. Now, however, lifestyle choices like including unhealthy diet, lack of exercises, obesity, diabetes mellitus, hypertension, stress, and smoking, which is a greatly increase the risk of having cardiac arrest. Now, the good news is that many of this are completely under our control, which we can modify, right? So, in the further slides, we are going to discuss that. Now, as I was talking about the risk factors, in my left hand side, you will see the non modifiable risk factors where I cannot change it. The first group, which is on the left side, if you all can see my screen, the first group includes the things we cannot change, like age. Now, obviously, we know at a age, the physiological changes will happen in our body. And at a certain age, the heart will develop all these conditions. Gender is again a very important factor. There are studies showing that men have higher rate of having cardiac arrest. If you have a family history of cardiac arrest, then yes, you cannot change. And ethnicity. Now, what is ethnicity? Ethnicity means from which population or from which country I do belong from. Indian, Africans, Europeans, Asians, right? So it plays a very major role. Now, if you see my right hand side, the second group, which includes the factors which we can control, like cholesterol, yes, it is under our control. Blood pressure, it is under our control. Diabetes mellitus, smoking, obesity, alcohol intake, and physical inactivity. So our focus should not be on the non-modifiable factors which are on the left side of my slide, but our focus should be on the right side risk factors which we can control and which are the modifiable risk factors. Now, cholesterol. Everybody knows about cholesterol, right? But do you know that there are some bad cholesterol and good cholesterol which our body takes? Now, let's discuss what is cholesterol and how it is destroying our body. So, I will not deny that cholesterol is not an essential part of our body. Yes, cholesterol is an essential part of our body because we require some amount of cholesterol in our body. But the problem arises when this cholesterol levels becomes too high. Now, excessive cholesterol, what will happen if I'm taking too much of oily foods? Now, excess cholesterol gets deposited in the coronary arteries, which gradually blocks the blood flow. Unfortunately, the high cholesterols usually have no symptoms until the complications develop. I mean, suppose I'm taking too much of junk foods, I'm taking oily foods, my cholesterol is rising, but my body is not going to show me any sign of symptom. Now, if you remember, I told you some sign of symptoms of heart disease like pain in my chest, shortness of breath, nausea, sweating. But when we have high cholesterol levels in our body, I will not get any sign and symptom. At a very later stage of time, some people will develop white patches around, I mean, on the topmost of the eyes. That is one of the salient feature of having high cholesterol. But other than that, you might not get many signs and symptoms telling you that yes, you have high cholesterol. Now the major question is, where does this cholesterol comes from, right? I mean, yes, one thing is our food item. So cholesterol comes from two sources basically. One is the food which we eat, especially the animal products like meat, eggs, butter and dairy. And the second source is our own liver, which naturally produces cholesterol. That's why both diet and lifestyle matters a lot. Now I can modify my dietary habits, right? But I cannot tell my liver that you don't produce more cholesterol. The liver is naturally producing the cholesterol, which again, non modifiable. I cannot modify my liver. I can only modify my diet, where I can understand that, okay, I am not taking this junk food, I am not taking oily foods, right? So I can reduce the level of cholesterol in our body. As I was telling, there is good cholesterol, there is bad cholesterol, right? So the bad cholesterol is called as LDL. Now, the full form of LDL is low density lipoprotein. Low density lipoprotein is known as the bad cholesterol. Now, what it does, it carries the cholesterol into the artery walls, forming the plaques. Now, second is HDL, high density lipoprotein, which is called as a good cholesterol. Now, don't think that it is showing high means it is bad. It's just the opposite in terms of cholesterol. If you have low density lipoprotein, then it is bad cholesterol. If you have high density lipoprotein, that means you are having good cholesterol. Now, what does this good cholesterol does? It helps in removing the excess cholesterol from the bloodstream and transports it back to the liver, which is very good for our body, right? Suppose I'm eating junk food, I'm taking oily foods, or my dietary habits, it's very bad. If you have high density lipoprotein, it will actually try to remove the excess cholesterol which is there in your body, and it will transport it back to the liver so that liver can naturally generate high density lipoprotein, which will be considered as the good cholesterol for our body. Obesity, right? What is obesity? Obesity is the extra fat accumulation in our body, correct? So obesity is defined as the extra fat accumulation in our body, and being overweight significantly increases the risk of heart disease. So one useful measure is waist to hip ratio. So what you can do, you can take a inch tape, you can measure your waist. So your measurement site should be, the inch tape should come around your umbilicus, and if you feel your body, there is a bony prominent around your hip joint, right? You have two bony prominent around the left and right side. If you can palpate that, if you can touch it, you will feel a hard surface, right? Hard bone around your hip joint. So you have to take measurements of both, and you have to divide it, and then you will get a hip waist to hip ratio, which will term that you are obese or not. So excess fat around the abdomen is particularly dangerous because it increases inflammation, which is infection, and insulin resistance, which will cause diabetes mellitus. So if you can see pears and apples, right? So if you see there, I mean, there are two kinds of people, okay? There is one population who have fat accumulation in their abdomen only, but there is one population who has fat accumulation in their hip joint, hips, and in the thighs. So not all body fat is actually equally harmful. So if you can see, I have mentioned pear shaped body and apple shaped body. Now please imagine the pear, how a pear, a fruit looks like, and how does an apple look like. So a pear shaped body stores fat mainly around the hips and the thighs, and the apple shaped body stores fat around the abdomen and the surrounding internal organs of the abdomen. And abdominal fat is associated with much higher risk of heart disease and diabetes. So apple shaped body is more harmful compared to a pear shaped body. So if somebody has a pear shaped body, yes, it is, I am not saying that it is good, but it is better than an apple shaped body. So if you are seeing any individual who has fat accumulation in and around the abdomen, please go to a dietitian, please go to a physiotherapist so that you can start your exercises and reduce the fat. Okay, gone are the days when people used to say that I am from a very healthy and wealthy family, that's why my tummy is coming out. Right, nowadays everybody wants a flat tummy because there are many conditions and many life threatening conditions which are happening because of this fat accumulation. Now this is a slide which is called as BMI, body mass index. Now I have portrayed it very clearly so that everybody can understand and everybody can calculate their BMI. If you have a pen and paper or a calculate, I mean a mobile phone in your hand, please calculate your BMI and check if you're falling under the correct criteria or not. Now the formula is very easy. So you have to write your weight and divide your height in meters. Okay, so you have to divide the weight in meters in square. So you have to write your height twice and then you have to get the score. Now if your BMI, now if you can see the screen, if your BMI falls under 18.5 to 24.9, then you are okay, your BMI is okay. Now if your BMI is coming more than 25, I mean if it is coming in the range between 25 to 29.9, then you are obese, or I'll say you are overweight. Right, now if your BMI comes under the range of 30 to 34.9, then you are, or you will be called as obese. Now if your BMI is coming more than 35, then you are extremely obese, you have to go and show it to a doctor. Now, the last criteria is if your BMI is coming less than 18.5, then you are underweight. Now, for that, you have to modify your lifestyle. You have to take good amount of intake so that your BMI comes into normal. So, from this slide, you can understand that you have to be in the range of normal. You cannot go into overweight. You cannot go into underweight. You obviously you cannot go into obese and extremely obese, that is very bad. So please try to maintain your BMI into normal. Now please remember this formula: BMI is equal to weight in kgs divided by height in meters per square. Okay, please remember, if you have not calculated your BMI, you can do it later. You can take a screenshot of this, know your BMI. Nowadays, if you just write in BMI calculator, there are many apps for it. You can just type your weight and height there and it will calculate your BMI, and they will also tell you under which range you are falling into. So this is a cartoon, right? I have put some cartoons so that we can understand this physical inactivity. Now first cartoon shows that he or she is sleeping, and then she has woken up, he is woken up with a cup of coffee, right? I mean, this is our daily routine. We woke up, we go to our daily activities, and then we'll be holding a cup of tea or a black coffee, correct? So every morning my brain tells me to do exercise, but my body laughs at my idea, right? I guess this is the scenario for most of the people, if I am not wrong, right? So but we have to change this habit. You cannot lead your life with this physical inactivity. Modern lifestyles involve long hours of sitting nowadays, be it IT professionals, be it professors, be it anyone. The lifestyle has become very sedentary. This laptop work, there's a lot of work which is long hours of sitting, right? And because of that, our physical activity has been decreasing. So physical inactivity increases the risk of obesity, diabetes mellitus, hypertension, and heart disease. Even simple activities like walking can make a very huge difference. That's why whenever you go to a doctor, they'll say that you just walk for 30 minutes, right? They just give this advice. And nowadays, I'll not say that people are not aware. People are very much aware about their heart, and not about heart only, about the overall performance of their body, and they are going for morning walks, evening walks, jogging. There are many people who are doing physical activity, but yes, there is a certain population who is actually inactive with physical performance. So there's high requirement of doing physical activity because it can arise many life threatening conditions or many serious conditions. Now, if you can see this slide, physical activity for adults and older adults. Now, we have guidelines, and they say that for a week, I mean, I'll not say all the 7 days, but for 6 days in a week, you should do physical activity of 150 minutes per week. So, if you can say 30 minutes in a day, correct? Okay, if you say 5 days in a week also, you should do a physical activity of 30 minutes in a day. Now, what this physical activity will help in? It will help the overall growth of the health, it will improve your sleep, it will maintain the healthy weight, it will manage the stress which will cause joint and back pain, and at last it will improve the quality